So for all of you who don't know who this is Dr. Patrick Sullivan, and he practices on Rhode Island. He has been a longtime professor at Brown University. He is a world-renowned surgeon, and his specialty is facelift and especially the neck. And the neck, as you all know, is something that is a very difficult area to get right. And even the best surgeons also can run into complications in this area. So we are going to be talking about all different case specifications for the neck, all different types of necks, different types of complications we could run into, what are platysmal bands.
So I think one of the most common types of neck deformities you send me, Melinda, are these kind of necks. This actually isn't one of my cases, although she did come to see me first. And you send me a lot of people like this as well, because she had these platysma bands. So as we were talking about turkey necks, and that's what she called hers, the turkey necks here. She also had some areas here that had deflated. I mean, she was just such a great candidate for me to take care of. She had these bands here that you can see from the side very well, and this lax skin, and a jawline that had lost definition, and big jowls. I was so excited about it. And then she went to somebody in Boston because she could get it done cheaper, and she emailed me these pictures. And she said, this is after. And she said, I can't live like this. And so, and I'm not saying anything bad about the surgeons, but it's very much a different technique. I got the surgeon's operative note, and he had liposuctioned her neck. And I can't understand any reason you take a thin neck like this and liposuction, but some people do it routinely. Mine is much more of a sculpting procedure where we release and refine and things. And the biggest problem is she wants me to do something about it, and there's nothing I can do.
And when we see these things come to us, you know, it's often we find that it's because there's a lot of surgeries in on one day. And we're going to get into this because Dr. Sullivan does one surgery a day, and he really, you know, it's important to him to put all of his time and effort into the one case that he's doing on that day. These are surgeries and procedures that cannot be rushed. And when you rush, like you see right here, this is what happens. And, you know, it's technique, and it's time, and it's patience.